So I'm going to verify with my MAR that Frank Miller, date of birth 7/4/58, needs furosemide. I'm going to go ahead and look that up on the drug guide. I see that it is a loop diuretic. He is not allergic to it. He's allergic to penicillin and Lipitor, so furosemide should be fine. It's a loop diuretic, so it's going to help him get rid of excess fluids. We should watch him for a decrease in blood pressure, urine output, daily weights, and decreased hepatic and renal function. And the labs that we should monitor for electrolytes are sodium, potassium, magnesium, and calcium. And then other labs to consider are the BUN, serum glucose, creatinine, and uric acid levels. So I'm going to do my first check. I have furosemide for Frank Miller, so it is the right patient, right drug. We're going to do 20 milligrams for the dose, so I'm going to give 2 milliliters of this. Route is IV push, time is now, and it is not expired. And then I have a normal saline flush of 2 milliliters. This is going to go in after the furosemide at the same rate. So I have right patient, right drug. I have the right dose, which is 2 milliliters. I have IV push for the route, time now, and it is not expired. And then I have the flush of 5 milliliters that I'm just going to get the rest of the air bubbles out. I thought we did. Okay, perfect. And it's right on the 5. Okay, so I have 5 milliliters for this. So right patient, right drug. 5 milliliters is the dose. It's going IV push. Time is now, and it is not expired. So I'm going to go ahead and get my stuff ready. I'm going to wash my hands. This little cap off. I'm going to scrub this for 15 seconds. Make sure that stays clean, set it up like this. While it dries, I'm going to get this stuff ready. So this is dry. I'm going to instill 2 of air. And then I'm going to pull back the med. Okay, and then I'm going to put my label on it that has the name of the drug, which is furosemide, the concentration, which is 10 milligrams per milliliter, and then the dose is 20 milligrams. And then on the other side, you can see the 2 milliliters over here. Okay, so I'm going to do my second check. So I have my normal saline. This is the 5 milliliter flush for before the med. To check for patency. So I have right patient, right drug. Right route is it's going through the IV. The dose is 5 milliliters. The time is now, and it is not expired. I have my second normal saline flush for after the med. It is Frank Miller, sodium chloride. It is 2 milliliters for the dose. It is going in IV push now for time, and it is not expired. It's also going to go in over 1 full minute like the med is going to. And then I'm going to do my check for the furosemide. So right patient, right patient, right patient. Furosemide is the 20 milligrams IV push. So I've got 10 milligrams per milliliter. I have 2 milliliters, you can see on this side. And then I have IV push for the route. Time is now, and it is not expired. Okay, so I'm going to go into my patient's room. Knock, knock, knock. Hi, my name is Mary. I'm your nursing student today. I'm going to give you your furosemide. Have you had that before? Okay. Can you tell me your name and date of birth? Washing my hands. Okay, Frank Miller, perfect. Okay, and I check that against his armband. And I'm going to provide for privacy. Do you have any allergies? And I verify that against his MAR, and he does not have an allergy to furosemide, so we're good there. So I'm going to put gloves on. Do you have any pain at your insertion site, your IV insertion site? He says no, that's good. I don't see any redness, swelling, drainage. I don't feel any heat. No pain when I'm touching here? Nope, good. Okay, so I'm going to do my third check. So I have the normal saline. So right patient, right patient, right patient. Normal saline is the right drug. IV push, 5 milliliters for the dose. Time is right now, and it is not expired. The second flush I have is right patient, right drug, right drug. It's 2 milliliters, so right dose. It's going IV push, time now, not expired. And then furosemide. I have the right patient, right patient. The right dose is 20 milligrams. I'm giving 2 milliliters because it is 10 milligrams per milliliter. It's going IV push now for time. It is not expired, and it's going over 1 minute. All right, so I'm going to clean this for 15 seconds. I'm going to do my first flush, which is the 5 milliliter flush. Okay. Going to unclamp. I'm going to aspirate for blood. I see blood return, so I'm going to push the whole 5 in. Do you have any pain with this? He says no. Very good. I'm going to reclamp. This is going into biohazard because it came in contact with blood. I'm going to clean again. For 15 seconds. Garbage. And I'm going to take this, and the needle will go into the sharps container. So sharps here. I'm going to unclamp. There. I'm going to watch the clock and start pushing. So by 15 seconds, I want it to be at 1.5. Perfect. I'm going to clamp this again. Our bench, I'm going to clean. And this is going to go in over the minute again. Okay, and I'm going to reclamp here and our bench, and I am going to document that I gave the med and the 2 flushes, that the patient tolerated it well, the number of minutes that I administered the med and the 2nd flush over, and my name and credentials.